Good morning, good evening, namaste, hola, bonjour, geremer, terve, and marapan. This is Namya Joshi, your host for the day. Welcome to episode 74 of the podcast Each One Teach 10, an amazing world of STEM, an inspiring venture where we'll be discussing that STEM is part of every day for every kid. We all will learn together how to build a STEM culture. Well, for today, my guest is Dr. Gladson Vaghela, who is a medical doctor from India, currently serving as a research coordinator at the Training for Health Equity Network USA, directing his efforts towards the attainment of social accountability in medical education through education, research, and service. He is a policy fellow of the Network Towards Unity for Health USA, a country representative at Healthcare Information for All UK, and serves at the Executive Committee of the Commonwealth Youth Health Network UK. In the year 2023, he made it among the top 50 finalists for the prestigious Check.org Global Student Prize. It's such an amazing opportunity to have you here, Dr. Gladson. So, how have you been?
Thank you so much, Nami. I think first of all, I think it is an absolute honor to be here. And first of all, congratulations to you for running such an amazing podcast. And I feel like it's more of an inspiration from you rather than me to see the amazing work that you're up to, and of course to share the stage of top 50 finalists of Global Student Prize with amazing uh, people like you. I think it is an absolute honor. I'm really excited to see how we can delve into this podcast, and I'm really I got the opportunity to learn about your podcast. I went through it, and I think it's really amazing how you're using this platform to inspire young minds out there. So, congratulations to you, and I'm looking forward to it.
Thank you so much. So, before we move on, we would love to know more about you and the work that you're doing.
Well, I think you just briefly touched in my the bio, and just for our viewers out there, I my name is Dr. Gladson Vaghela. I recently graduated with my MBBS degree. That's the undergraduate bachelor's degree in medicine here in India. um, I got my license, which means that I can now practice medicine here in India. But this also means a greater responsibility to know and appreciate the healthcare system, and a healthcare system that serves 1.8 billion individuals. So I think, given an opportunity to work in a very complex yet a diverse healthcare system like India, I think it's an absolute honor, yet very challenging. At the same time, I also got the opportunity to work with many organizations over the past years. And currently I'm working as a research coordinator for the Training for Health Equity Network, which is based in New York, USA, which gives me an opportunity to work in research projects that helps to empower health institutions to make a more robust, and most importantly, how we can make our healthcare system more socially accountable. So that is the brief idea or that I would like to give for those who are new to this field. Yeah, that's about me. I've been very active during my undergrad. I've been very active in student organization. I have made sure to represent the voice of medical students at high level meetings to make sure that young people and their voices are heard in front of the right people in the right time. It has been quite a journey, and I'm really excited to share all those learnings today in this podcast. So that's all from my end.
Thank you so much for sharing that. That's really, and first of all, congratulations to you for getting the license. And it's amazing that you got the opportunity to work in a complex yet diverse system in India. And, it's amazing that you have the vision of making the healthcare system more socially accountable. So that's really inspiring.
Thank you so much.
Moving
Yeah.
on, I would like to ask you what motivated you to pursue a medical education and what challenges did you encounter along the way?
I think what really motivated me, well, that goes, I would say there are many experiences, and personally, mostly personal experiences that really motivated me. One of them, which is a driving force, is my own grandmother. So, um, my maternal grandma, she suffered with an endometrial cancer back in 90s, and when she wanted to access care in a government hospital back in the days, there weren't much government hospitals providing cancer treatment, and those that were available, which were in Ahmedabad, while she was admitted, it was during that time the Nav Nirman Andolan, which means a social reconstructive movement. It was a political movement that was going on back in those days. And I think because of that movement, most of the hospitals were shut down. Many of the protesters, used to stone pelting, at hospitals, which resulted in mass discharge because administrations were not able to treat patients in such environment, and rather to die with those stones, hospitals decided to mass discharge all the patients and let them go and die on their own in the comfort of their home. So this was the situation, and as a result, my grandma was unable to receive the care which I believe she so strongly needed. As a result of that, my grandma succumbed to cancer. Now, things didn't end it here. It has its own repercussions. Whenever there is a lack of care to any one individual in any family, it has repercussions for many more generations. And I think my mother had to bear the brunt of that lack of access of healthcare. Um, After my grandma's death, my mother, she was the only woman left in the household, and raised in a family which is rooted with patriarchy, and which expects women to do household chores. My mother had to give up her studies, and she was left with no option but to do household chores and to look after her family. So this went so worst that at certain point my mother wanted to commit suicide in her young age because of all these experiences. Luckily, she didn't. Later on, she went on to marry my father, and then she, gave birth to my elder sister, and then me. But when I learned from her experiences, I think that was one of the motivating factor that no child, or in general, no person should be devoid of basic healthcare services. And I think what my grandma went through and the repercussions of those incidents that my mother faced, I think this speaks in volumes about how lack of healthcare can affect not just only one individual, but it can affect many more generations. And I feel, because I have personally experienced in my own family, and I think that was a reason that really motivated me. So I have an elder sister. So my sister and I, we are from the first generation in our family who ever attended university, and I'm in fact the first person from my entire family and background to become a medical doctor. So it's quite a privilege, and I think this is the story that I want to tell other young boys and girls out there, that it doesn't matter where you come from, it doesn't matter what you do. I think if you have the determination and power to do that, I'm certain you can achieve whatever you want. So yeah, that has been the motivating factor of um, how I got into medicine in general.
That indeed is really moving. That you've had, personal experiences, like first being your grandmother as a driving force. Not much government hospitals were available, and hospitals shut down due to mass discharge, and then lack of healthcare because of that. Your mom had to do household chores, but she didn't give up. Like you said that she wanted to commit suicide, but she did not give up, and that's the most important lesson that you got to learn. And the really, I think even more important is like no person should be devoid of healthcare. That indeed is the strongest message, because if one person in the family is devoid, then it does pass on to the coming generations.
Right.
And
Exactly.
absolutely, if it doesn't matter where you come from or what situation you've dealt with yourself, if you have the determination and you work hard to achieve your dreams, that nobody can stop you.
Very true.
Thank, thank you. So, could you also share some study strategies that helped you consistently perform well in your medical school exams?
Oh boy, I should be the last person to advise you on how to study, because I would be very honest, and I think this is also one of the facet of a perspective that people should know is, um, you know you can be an average student, and yet you can make a difference in the world. So um, to be honest, I have been for a major part of my life in my schooling and even during my my medical school, I have been an average student. I would never say that I was a top ranker or something like that. What really helped me was being persistent, and I think this was very much helpful up to my high school. To be persistent and to keep revising certain topics that you do not, you couldn't get a grasp very easily. I think that has really helped me as one of the strategy to move ahead. During my med school, I think medical studies, indeed it was very, I think, exhausting, socially, physically, mentally, and sometimes even financially. But and I would be honest, so you know going through medical college is very, very draining. But at the same time, I also believe if you strategize what you should study and how you should study, I think um, it would be really helpful. And one mistake that most students do often is they want to complete everything, like the entire textbook, the entire syllabus. Sometimes it's okay if you do not get the chance to go through everything. Sometimes it's important that you focus on something which is more of your primary focus, and something that you're gonna something that has high chances of coming in your upcoming exams. Now, I'm not discouraging others from going and studying what's out there in your entire syllabus, but I think strategically planning and working smartly is often very important. And especially, I'm talking about syllabus and curriculums like medical studies, which is really vast. And I think you really need to understand that what you should be studying, what is required for your exam. So demarcation of those part is very important. And I think learning from the experiences of your seniors is also very helpful. And I think it was really helpful for me, especially during my mbbs, to learn from the experiences. And I think I was really blessed with some amazing seniors who really guided us well about how you should go ahead, and how you should plan, how you should work smartly. I think such strategies would be very helpful. And again, one thing that has been really helpful, revising. I think I'm also lacking on that part, and I'm still learning. I think it's a process. The more you revise, I think the more grasp you get over the topic or the subject that you want to master. So I think revision is very important. No one, you know, there might be very few people who get the topic or have a strong hold of any topic at the first go. It's all right if you have to go through the same topic once or twice. It's absolutely okay. And I think that should be your strategy for all the students out there.
I would affirm to the fact that persistence is incredibly important because it proves to the person that you're trying to reach what you're really passionate about,
Right.
and they really want to, do something with their full passion. And absolutely strategizing what and how to study is also essential, and seniors guidance as well is very beneficial for us because they help us, in mistakes that they did and which we should not, commit in our
Mm.
study life. And revising utmost important thing that even I have to, master, because I'm always, learning. But
Mm.
sometimes revision, lacks
Mm.
some one or two points, and then you intend to lose marks. But yeah, it comes with time. Absolutely agree with that.
True. I
Right.
think I think I did my entire high school and even my undergrad, and I'm still learning. So I think I won't force anyone, or I mean, it's a process, absolute process. Learning is a lifetime process, and I think uh, sometimes it also happened like the strategies that were helpful to me during my high school is not useful at this point of my life. So you have to grow. It's an evolving process, and you have to adapt accordingly over the situation, your time, and everything. So that's the thing. And to all the young boys and girls out there, I think one message that's very important. Whenever, I think there are so many youtubers out there, so many information available, blogs, youtubers, and right now even I'm giving this information out there. It's very important for you to analyze that we all are sharing it from our own experiences, what was good and bad for me. So now you have to decide, the person who is listening to us or viewing us, they have to decide what would be best for them. Blindly following anyone or any YouTuber or any person out there on social media might be hazardous oftentimes. So you have to be very smart in terms of, in an era where we have a huge amount of information available, at just one click. You should be really mindful of what is, useful for you in your situation, in your context. So I think that is something also people need to understand. So,
Absolutely, we need to learn the art of application of information.
true, true.
Right. So, what inspired your involvement in mental health activities?
Right. Well, that's God. I think it all started. So I was in my second year of my um, medical college, and since my first year, and in general, I wanted to volunteer. I wanted to utilize my time for something better, to help people out there in the society. This was just out of genuine interest. um, and when I was in the second year of my medical college, I applied to several um, organizations online. I just came across a blog, and those organizations that were active in Ahmedabad or Gandhinagar, you know, in Gujarat, I just signed up for all those organizations. And after 6 7 months, I heard from an organization named Make a Difference. Make a Difference is a national level organization that works for children in need of care and protection. I got a chance to be a part of that organization, and this organization helps us to work with shelter homes in your cities, and you get a chance to teach students residing in these shelter homes. um, I got a chance to be a part of a shelter home, and I used to go and teach. As you know, we used to give extra academic support to the students. What happened was, during COVID, because of COVID, most of our on-ground operations were, we were unable to carry out our on-ground operations because of COVID. Shelter homes were not allowing outsiders, including us, to go and teach there. And as a result of that, most of the students were, you know, isolated. They were unable to go to their homes. Their schools were not, I think they were unable to go to their schools because schools were closed, shut down. So they had no access to, I think, any social life out there. And during all this turmoil, one of the child in one of the shelter home, he committed suicide. It's also important to understand that most of these children living in shelter homes, they are already victim of violence, abuse, broken families. They are going through a lot of in their life, and amidst all this, they have to face the isolation of COVID-19. Amidst all this, you know, one of this really amazing young boy, I would refrain to say his name. He committed suicide, and his suicide really impacted me because I was very much close, and I saw him, his work, his studies, and a young, promising man. And he wanted to become a police officer. uh, Unfortunately, he gave up his life, and that really impacted me. And I think that was the point where I wanted to do something for society in general, but I had no idea how to go ahead. And in 2021, there was this research grant for medical in general for healthcare students, by the National Institute of Health and Care Research of the United Kingdom, and I got a chance to apply. I gave it a shot, and I got selected. I was awarded this grant, and I went on to carry out this project in suicide prevention. And I think our project is still going on. We're in this final stage, and hopefully, we'll be publishing our findings. So we try to analyze how suicide prevention services functions, most importantly the helpline services, and how they are able to uh, cater to the needs of those who need help out there. So it's a survey based study. We also try to find out the functional suicide prevention services around the world. We made a database of all the functional suicide prevention services. It's an exhaustive list. and we'll be producing a database, a global database that would help other young boys and girls and people out there to access these services when they are in need. So yeah, we are in the final stage, and hopefully we'll be able to publish our findings, you know and the world would have access to it, of course, and whatever any tangible difference it makes, I'm very much looking forward to it. So I think that's how I ended up in suicide prevention and in general, suicide and mental health care. And it has been quite an enriching experience to understand and appreciate how people functions and governs, and how suicide, which is considered a taboo often in many societies, but it impacts lives and individuals and impacts families and many more generations. Again, it was also driven by my own personal experiences. As I mentioned, my own mother was on the blink of committing suicide because she lost her mother. So I think all these factors somewhere helped me to understand and appreciate it, and I'm really glad that I got a chance to delve into this. So yeah.
Truly, we do learn from various experiences of our lives, like being part of Make a Difference, where you got a chance to, teach students in the shelter homes. And due to COVID-19, because everybody was isolated, one of the child, a bright person who, did amazing things, like you said, gave up his life. But, like in 2021, you said about the grant that we were awarded, you start the suicide prevention, and so that everybody in this world who is facing any of the mental issues knows that I have a hand to reach out to, and there is something that I can also do in my life, and it's not worth giving up on. So that's amazing. So I think we've had a lot of talk about how the wonderful work that you've been doing. So I would like to lighten the mood a little bit, and I have a fun question to ask you. So who is your favorite stand-up comedian?
Oh boy, favorite stand-up comedian. I think I I do watch a lot of stand-up comedians, but I'm unable to guess the name of the person at the moment. But I am really I'm not so much sure with the names yet. But I'm not sure when can we call him a stand-up comedian or not. But Ashish Chanchlani, uh,
Okay,
yeah, I
yeah,
think.
YouTuber.
Yeah, he's a YouTuber. He's a very famous YouTuber, and I think I really like his videos, and it's really quirky. It's fun, and and I think it's very uplifts your mood oftentimes. So I think I would say him. Yeah, Ashish Chanchlani. I really like his videos, and how he tried to give, because I assume he's a Gujarati, and he gives that Gujarati
Yeah,
touch in his videos, and I think so I
yeah.
can even relate to that very well. So because I'm a Gujarati as well, so I think I would say Ashish Chanchlani. I'm not sure if you had
Thank
the
you for
chance to
sharing.
go through his video. I assume you had.
Yeah, I know almost every Indian YouTuber and like stand-up comedian. Like the lockdown gave me a lot of time to go through them.
I think that.
But like if I
Exactly.
would
I
choose
think.
my favorite, I'd say Rahul Dua, like because he has amazing stand-up comedies, and like in English, I think if you've heard about Trevor Noah,
Yes, yes, yes. I did.
yeah,
Okay.
I think these two would be my favorite.
Right. I'm not sure about the one that you mentioned about the Indian one, but I guess I can go through it. Yeah.
Yeah,
Yeah. As I said, I'm not so
it'll
much.
be a worth shot.
I'm not so much into the names of this, but yeah, I think Ashish.
Yeah, but I'd say I prefer YouTubers more than stand-up comedians because the quality of content that YouTubers make, like sketch videos, they're actually
Exactly.
amazing.
I guess so. Yeah, I think it's very interesting to see how, in general, influencers, social media influencers, come up with so much of efforts. My goodness, I think it's really commendable. All the, even reels and shorts and videos out there, just for a few seconds, but it takes so much of efforts to come up with. So heads off to them out there. It really is a full
Absolutely.
time, a dedicated job to pursue. So yeah, definitely.
Absolutely. So, I want to ask you, what is the most significant impact your work has made on global healthcare and education equity? And can you recount, a meaningful experience from your volunteer work or activism that has left a lasting impression on you?
That's okay. Well, There are many, but I think one that really had a lasting impression, of course, will always be my time at Make a Difference. I got a chance to work for 2 consecutive years at Make a Difference, and I taught briefly at Teach for India. And at both of these places, I got chance to engage with young minds who are studying in resource limited settings, who comes from families and backgrounds which are usually disadvantaged. So I think that was an absolute pleasure that I would cherish for the rest of my life. This interaction, and I can, I would still like to go back and to work among them. Unfortunately, I'm not recently based in Ahmedabad, Gandhinagar, and organizations like Make a Difference are not active in my city. But again, if I get a chance, I would really like to go back and join. But I think that would be an absolute honor that I had, and something that I would cherish for the rest of my life. Um, and talking about impact, I think working with many organizations and institutions, you get a chance to represent the voice of young boys and girls and young people out there. And one of the recent encounter that I had, and I think it's also something speaks about the opportunity that I had to represent young people, was at the 10th Commonwealth Youth Ministers meeting. Just recently, I got an opportunity by the Commonwealth Foundation, based in UK, um, to represent the young voices at the 10th Commonwealth Youth Ministers meeting that took place in London. Um, so it was quite an amazing gathering of youth ministers from almost 56 countries of the Commonwealth countries. It also gave me an opportunity to acknowledge and appreciate and to meet young leaders from around the world, including youth leaders and youth awardees. Uh, and I think that was quite an experience where I got a chance to interact and to put forward my voice in a more meaningful manner in front of these ministers, and to make sure that they invest in the health of young people. So I think that has been quite an experience, and to see how really young people can make a difference. And it's interesting, at the end of this meeting, the MOUs were signed, and ministers have agreed to invest in the mental health of young people, which was something that I never expected that would come out. But yes, I think the memorandum has been passed, and I think now eventually the Commonwealth will, most of the Commonwealth countries will adopt this declaration and will try to implement it within their countries. So I'm really excited to see how Commonwealth countries go on to implement this, something that they have agreed to, and how they invest in the mental health, how they are going to utilize AI to tackle some of the problems around the world in terms of healthcare, in terms of employability. So it was quite an interesting opportunity to put forward your voice in some of the most influential people, powerful people who are really going to make the difference. So I think that is something I would cherish, and sort of an impact I was able to create through all these years of experiences. So yeah, that is something I would like to acknowledge at the moment.
That indeed is encouraging and influencing for other young people as well listening to us right now. That you inspired young minds from disadvantaged sections of society, and the impact has always been representing the voice of the youth. Like you had given an example of Commonwealth Youth Ministers meeting in UK, where you got the opportunity to represent the youth, where you put forward your voice, about investing in health of, and specifically mental health of young people. And as you said, the memorandum was passed, and that was really, amazing opportunity for you as well to be there and giving your inputs to the youth ministers. And that's amazing that the Commonwealth countries are going to adopt it, as well as focusing upon how AI, like you said, could be used for encouraging and in basically making sure that health of people is going to become better as we go forward in the generations.
True, and as you were, mentioning, it's interesting how I'm not sure, but somehow I think mental health somehow got aligned in my aspect in my volunteering. And I think last year I had the opportunity to represent medical student voices at the World Health Organization regional committee meeting for Southeast Asia that was held in Paro, city of Bhutan. And theme for that year was mental health again. And we and member states have adopted Paro Declaration, which means to focus on mental health care services, to make mental health care services more accessible at primary healthcare level. And all the 11 member states of Southeast Asia have adopted the declaration. And I'm really excited. So after 2 years, they would give updates. So most probably in 2024, member states would come back and would give update on how they have worked on this declaration, how they have achieved this. So I'm really excited to see probably in next year what they have done, including India, because India is also part of the Southeast Asia group. So I'm really excited to see how I got the chance to be part, to witness, and to participate in the Power Declaration. And again, this year I got the chance to be a part of the Commonwealth Youth Ministers meeting, where member states have agreed to invest in the mental health. So I think somehow experiences got me, and it revolves around mental health. I'm not sure how, but yeah, I think I got this chance, and I think so. Yeah, really thankful to God for this opportunity, and I am just looking forward how how it's going to be implemented on ground, because oftentimes there has been always this debate that and many times people tell me that you discuss this a lot. There's a lot of high talk and there's everything at the high level. There's nothing on ground. My only counter argument to this people is has always been is that if we do not have things sorted at the policy level, it's never going to be implemented on ground. So it's very important for us to work on the policy level, even if it's not going to be implemented on ground easily. At least after a few years down the road, people would go back and question the government that, hey, you signed this declaration, you agreed to do this, why aren't you doing this? So my only counter argument to all the people out there who feel that this all conferences, meetings, and this gatherings is just high fancy talk and nothing on ground, I do agree to a certain extent that it might feel like that. But I think I just, the only message that I would like to give is, we have to work at the policy level to ensure that we have it on ground, hopefully in coming years, and we have the opportunity to question the government and to put them in a position to work on that matters that they have agreed to. So I think anybody out there who gets a chance to be part of such thing or to engage in such thing, I would say go ahead. And I think it's a very promising and great opportunity to put forward voices of young people, and it's never a waste of time.
Truly. So before we wrap up today's discussion, we would love to know where we can find you online, and we would like to have a message from your side as well for the audience listening to us right now.
Right. I'm available on every social media, Instagram, Facebook, Twitter, and LinkedIn as well. And I'm active almost on every of those. You can find me on Instagram, Dr. dot Gladson Vaghela. So you can find me there. You can use the same username to find me on Twitter, and of course on LinkedIn as well. And I have quite a unique name, so it won't be hard for you to find this combination of name. Apart than that, my only message to all out there is, um, I think I have learned uh, this thing that we often, as young people, we often succumb to peer pressure. And even I did. It's not like I haven't, I did as well. But my only message would be that don't be impacted by what other people think and what other people say, whether it's your community, your classroom, or whatsoever. If you are passionate about something and if you feel it's something that would help your career to propel and would make a difference in the world, go ahead. Just go ahead for it. And if you have the support of your parents, definitely go ahead for it. There is, you should never feel like, okay, this is not something worthy, or this is not gonna make any difference at the end of the day. So I think my only message is never succumb to peer pressure. Follow your heart. Life is too short to listen what other people think. So that's my only message out there.
Thank you so much. And listening to you today has just reminded me of this thing that experience is not what happens to you, it's what you do with what happens to you. Thank you so much, Dr. Gladson. It was amazing talking to you today. And I hope you had a wonderful time, you know, giving your insights and sharing all the wonderful experiences that you've had with our audience today.
Thank you so much for having me. And first of all, once again, congratulations to all that you do, Namya. It is so amazing and inspiring to see a young girl like you doing all this. When I was of your age, the only thing that I was worried about the acne on my face and pimples and and other life problems. But I think the seeing young you know men and women like you who are so passionate about making a change and difference in the world, I think it's really inspiring. So go ahead and all the best, and I'm looking forward to see where you go ahead in the future and the difference that you all make. So that's it, and thank you so much once again, and I hope to all our listeners out there, work hard, stay safe, and all the best.
Thank you so much, and thank you everyone for joining and listening to this episode. And I'll see you in the next one. Till then, each one, each 10, have a nice day.